Health and Development Magazine News Brief. Health and Development Magazine News Brief with Dr. Thompson Akwo Ntuba. Global COVID-19. Global COVID-19. As of today, with a briefing with the World Health Assembly under the leadership of Dr. Tedros, a number of issues were raised. One having to do with strengthening health systems and provision of commodities, and the finances of funds that are necessary. It is said that there is a shortfall and an expected $4.3 billion for the World Health Organization to be able to procure or work with governments, especially those of poor countries or middle-income countries, to possess or purchase vaccines for their people. There were issues about assessment of the vaccines which are being rolled out by the companies that are producing them. And people are told to know that there are certain nations that have the right or are actually accessing and regulating these vaccines themselves. And there are also other nations that are dependent on the WHO through its mechanisms and instruments put in place for assessing the efficacy and quality of the vaccines. Nations like the United Kingdom had gone ahead to assess and evaluate the efficacy and safety of the BioNTech Pfizer vaccine and have already started rolling them out and injecting the vaccines to others. Well, America, through its advisory committee of the FDA, is preparing to give emergency authorization for the vaccines to be rolled out and to be given to people in the different states in the United States, the counties and the cities. Many people do not know when they watch these vaccines being given to people in UK and other countries, while that is not happening in their countries, in South America, in Eastern Europe, in India, or other areas in Africa, and they're asking questions. And Dr. Tedros was clear with Dr. Ryan and the others who are part of the briefings and other emergency-related work which is happening at the level of the United Nations. They are very clear that there are issues which are addressed at national level, and there are issues which are addressed under the COVAX and the ACT Accelerator instruments at the level of the United Nations. But as it is known as of this day, Friday the 12th, that these vaccines are not actually available for every country as of this time. And even the countries that are already secured certain quantities, whether be they in millions for their people, they will be distributed and administered in a prioritized fashion. So much so that those in very high-risk groups, like those in nursing homes and those caregivers over there, the first-line responders in the hospitals, are given the vaccines first. The issue of trust originated from Africa. If Africans are going to take the vaccines, especially the discussion in South Africa, and Dr. Ryan was very clear that Africa has a history of using instruments or the toolkit of vaccination as a protective device over the years in the eradication of polio and the fight of other diseases like Ebola. And there are instruments in place. There is a need to strengthen the health system and to build delivery capacities and human resources in order to administer the vaccines when they are available. But the final cry is that these vaccines will be made public good, and WHO through its partner countries or the member states will have the committed pledges in money to be able to acquire these vaccines, especially for those less less fortunate countries that are dependent on them. And the final thing is that vaccines alone will not stop coronavirus. Vaccines are just one of the ways which, when combined with other public health measures, will bring about a control of the